Hello, hello, hello. Happy Friday. Welcome, welcome. We're back, Center PC. Today we're in the Center Yourself Medical Spa, and Dr. Downs is in the house. So he is back on live, and today we're going to be doing Juvéderm Voluma. And for those that don't know what that is a dermal filler that we use here for more of your cheeks. So it is FDA cleared for cheeks. And if you have any questions at all, I always say please comment below, and he'd be happy to answer those while we are injecting Voluma. So any questions at all, please comment. All right, here we go. Voluma.
Go away.
I'm back.
Oh my gosh.
So usually Melissa does the procedures, and
I know, we're turning the tables today.
I know.
So are we live? We're on
We are.
Okay,
we
good.
are.
So
The numbers are
welcome
jumping.
to Friday's Facebook Live. I'm glad everybody's inside watching this because it's hot and humid outside. So where would you rather be, right?
Right.
So today what we're going to do for Facebook Live is we're going to demonstrate Voluma. Voluma is a hyaluronic acid filler material that we use. Now hyaluronic acid is a pretty common substance in our body. It's what we call a ground substance, which means it is part of every cell that we have in our body has hyaluronic acid. So it's a very natural thing. So it's obvious, and it makes for a great filler material. It's a very natural filler material. Now there's different parts of our faces that require different types of fillers. So the hyaluronic acid is nice because based on the types of bonds and cross bonding and how it's manufactured, it can be thicker or thinner depending on where part of the body we're putting it in. For instance, if you're going to put it in the lips, you want something a little thinner, a little runnier, a little more easily distributed. Whereas in other parts of the face where we need more structure, we want a little bit thicker consistency. So the Voluma is really designed for a little bit more structurally to help boost parts of the face. So what we're going to do with Melissa today is use Voluma, which is really great for cheekbones. So we're going to use this to augment along her cheek areas here. Now the nice part about the cheek area is when you volumize that, it kind of lifts everything a little bit. It lifts the jowl area. It helps correct a little bit of the nasolabial folds, because basically what we're doing is we're replacing what Mother Nature's kind of taking away from us as we age. Because as we thin through here, everything kind of drops this way. We start to see thicker or more deep nasolabial folds. So by rejuvenating this part of the face and volumizing it, it works very nicely. The volumization with this, with the Voluma, is very, very natural. And unlike other fillers, we put it deeper. And we put it deep to the face. So we almost put it right on where the bone is. Now she's already cleansed with alcohol, and she has some numbing medicine on that she's been using for a little bit. Now, where do we inject this? So we'll do it on this side. I'll show you. So on a face, if we draw an imaginary line, say from this little bump on your ear called the tragus to the very top of your nose crease here, pretend that's an imaginary line. And then if we drop a line imaginarily down from the corner of the eye, we know that right about there is her point of maximum projection. So we're going to do the same thing over here when we go to inject the Voluma.
And Lady Grace, I will show, I saw this on Instagram where it was really cool to show you like kind of what's in a syringe and how there's not always a ton of product in a syringe. So.
Right. So if we draw that imaginary line, all set, I'm going to go big pinch, and we're going to go right down very carefully, and we're just going to slowly, now there's numbing medicine in this, so you start to feel a little bit of a bee sting initially. Now I have my hands and fingers there. Now to avoid multiple pokes, now I'm going to go a little bit more medially. We're just going to go slow, and I'm going to watch what I'm getting in terms of puffing up of that tissue. Then we're going to come a little bit laterally.
Now I know you've talked about the fanning process.
Yeah, well, I'm cognizant of where the tip of my needle is. Instead of coming in and out multiple times, I'm putting it in the same place. Now, I will have to retract the needle a little bit, and I'll hold a little pressure there, and I'm going to look and I'm going to feel Sometimes you can get a little bleeding at the injection site. I will probably come a little bit more medial on her. Now, there's a nerve that lives right here. We don't want to inject the nerve. She would not like me very much if I did that. So we're going to come a little bit in here because we're going to feather it so it doesn't look like you have this ball of tissue there. And I'm feeling the material go in.
Now this is one syringe, so
this is going to be one syringe on each side. Sometimes we can do a little bit more, depending upon how much volume we're trying to achieve. I'll hold a little pressure there, because sometimes you get a little spot. You can see the little injection spots. And I'm feeling where the material is. Now we know this is kind of a natural triangle, right? So we're going to come down here a little bit. Is that hurting you at all? And again, it's not a fanning thing as much as I'm just retracting a little bit, and I'm pushing the tip of my needle. Because remember, I'm putting this in an area. I'm not stretching it out along a line. I'm not doing anything along those lines. So.
How do you feel, Melissa?
It feels fine.
Except you can't see out of her right eye right now. No, I'm just kidding.
You feel a little bit of a tiny sting of the needle going in, and really you feel nothing else.
And I'm just using the little bit I have left to just kind of feather it over into the zygomatic area. And that's all there is to it. That's a full syringe.
So what makes a great injector to be able to inject this product?
Well, you have to be way more than 200 pounds, and you have to be really tall.
Do you have to have hair?
No, hair is bad.
Okay. Then
You need to be bald.
So, Michelle, she has hair.
Okay, she's out. So what I'm going to do now is I'm going to hold a little pressure there, and then what you can do is we can for a couple minutes we can mold if we need to.
For those who
But
don't
she
know,
feels very smooth.
Michelle is one of our injectors here,
So you can see very subtle increase here, very nice. It helps the tear trough area, and it gives a nice elevation to that cheek.
So I want to point out, for those of you looking, you can tell on Melissa's, I guess it would be left side, is already volumed up compared to her right. So you can already see that definitely a before
It's her
and
right,
after.
by the way, Shana.
Well, my left,
Okay.
yeah. They're viewing it, like if they look
I got you.
left, right.
So I'm just going to hold a little pressure there. Now there can be some bruising at the injection site. Usually there's not, but like I said, we'll hold a little pressure there, and you can see there's really little bruising. There's restriction-wise, she can go right back to work. We're going to have her avoid any strenuous exercise for about 24 hours.
Any pre-care at all that she needs to do?
Really not. I mean, there's nothing to do here. We're going to keep her from like massaging that area for a while, because we don't want her to, because over the next 24 hours she could move the product. Now I'm going to come around the other side.
Okay, we're going to flip. Again, Michelle, say hi. She's one of our injectors here.
Hello. Hi, everyone.
So if you would need any type of injections, she can definitely help you out.
Okay, so again, now you can really see it when you look at her cheeks from what I call a three-quarter view. So you come this way, and you can see the improvement that we've made, and the prominence that we've put right here on her cheek, which is where it should be. So depending on how the lighting is, the light, how when we put makeup on, you try to make that so the shadow, you contour that so it catches the light. Well, that's what when you volumize that, it really contours that and it catches the light nicely. So again, imaginary line.
Someone says Dr. Downs is the best.
Oh gosh. And a bee sting. 1, 2, 3, go. You all right?
I'm fine.
And we just go real slow, and I'm feeling with my fingers kind of a tactile response of where that material's going. Feeling that hers. So what you're seeing is actually her natural tissue coming up. It's not the filler. The filler's working from underneath.
So you almost go all the way to the bone?
I go exactly all the way to the bone.
Okay.
And I pull out. Again, just being cognizant of where my tip of my needle is, because that's where the material is being deposited.
Someone wants to know what happens if you hit the bone.
It's a little tingly. It hurts a little bit, but it doesn't. There's numbing medicine in this, so after the first little bit, you don't feel much anything.
And how long does this product last for?
The product will last about 9 months to 12 months. It's so easy to inject. And it's such a nice product. And again, I'm going to mimic what I did on the other side. I'm going to come here a little bit medially.
Now, do you recommend patients for Voluma after they've had a facelift?
Facelifts are different in the sense that we're pulling all this up naturally with the surgery. It's not uncommon to use some volumization in your face following facelift. Typically, it's going to be more in this area, which we would not use Voluma for. We would use something different for.
So would you only
like
use
a sculpture or something along those lines?
So do you only use Voluma mainly for cheeks?
Voluma is usually used for cheekbones. Yes. Okay. This area that what I call the malar area, which is the area I'm injecting. Like if you think, you come in and you say, "Oh, I think I need cheek implants." No, you probably don't. We probably could get very nice result for you with the Voluma. So again, I'm just feeling where the material is. Again, I'm going to feather it back here along the zygomatic arch, so it doesn't look like there's a big drop off.
And Voluma ranges from $850 to $900 per syringe.
And that feels nice and smooth, very natural. You can't tell there's a filler in there. A little bit of punctate bleeding where I injected. So you just hold a little pressure there.
And will Melissa be able to put makeup on right after this?
In about an hour, I'll let her put makeup on. That's fine, but very gently because I don't want none of the massage the area.
Could there be some swelling at all or bruising?
There can be a little swelling, but there's very minimal. And the bruising is usually at the injection sites if we hit a vein or something along those lines. But nothing that's bad. You can't just put a little makeup on and cover it. But there's very minimal swelling, very minimal reaction. Hyaluronic acid is a great material because it's what we call inert. You can't be allergic to it. You don't need to be skin tested. You can't have a reaction to it. So it's a real nice product from that standpoint. It feels very natural. You run your finger along there. You don't feel lumps or bumps.
Which isn't something that you can get with other products. Like I know, like people.
Well, there's some heavier products, for instance, like which we use, Radiesse and those types of things. They're thicker. They're more crystalline in structure. They're not gel. So, you can get clogs of those crystals in places that you might not want them. It's good for certain parts. I don't like to volumize with it personally. There are people that do it. That's fine. I don't have any problem with that. I don't. I think that when you have a product like Voluma, where we can go ahead and very smoothly and very naturally augment the cheeks, I would be very hesitant to put something in like that wouldn't get you a smoother result.
Right. And Voluma is FDA cleared for cheek augmentation. For those information.
So she's got a little bit of
contouring.
No, she's got some vessels there that we're gonna little rosacea.
Only for
so
you,
we'll
an
hold a little pressure.
Little rosacea, little melasma.
Someone says, "Love Dr. Downs." Are you sure, Barbara?
Yeah, right. Yeah. That's Shayna trying to make problems.
I know.
So look at her contour. She's just been injected. So this is you. You've come in. You get your injections. You can go back out and just go back. You're not going to go and scare small children or animals. But when she smiles, go ahead, give a big smile. See the nice nice contour. And if you go with that 3/4 view where you come in kind of like this direction, you can now see the shape of the cheek. And that's really what it ought to look like, as opposed to what I would call the number 3 sign. We don't have a...
And then someone asked us what are the best places to put Voluma.
The best what?
Places.
Well, Voluma we really put in the cheekbones. We don't really put it anywhere else. If you're going to do lips, we have different materials that are a little softer, a little runnier. Now, when you do nasolabials, we're going to need something that's even more structurally firm than Voluma. Like a Juvéderm or you know, XC or Juvéderm Plus, or you can even use Radiesse quite nicely in there if you needed to. But I don't think that there's any better product on the market that does that nice job on the cheeks like that, and it looks real natural. So that's Voluma. We use a lot of it. It's easy to inject. You know, it doesn't hurt. It's well tolerated, and it's very soft, smooth, nice contour result. So that's our Facebook Live. Any other questions anybody has?
You answered a lot of them. Melissa, do you mind sitting up a little bit and smiling so people?
Sure.
That way we can get the final. Ooh, love that. That's a great look.
You want to see
Definitely
her?
so.
Yeah.
Because you don't know what we're looking at yet.
I don't. It looks beautiful.
Yeah.
I'm glad you said that. I would
No,
bad and
no, it
wrong.
looks beautiful.
Really good. Look, Sarah.
Oh.
What did you do to
And
me?
it was so easy. It did not hurt at all.
Yeah.
Have enough numbing cream on. It did not hurt at all.
So we have some people commenting, you look great, Melissa.
Thank you.
Love it, Melissa.
Look better with makeup later.
I know. We'll show her after.
Sorry, you just went on the World Wide Web without makeup.
That's
I know.
okay.
And then Jenny asked about cost. I believe it's like $850 to $900 a syringe. So we
Right,
just
and
did 2 syringes.
We did 2 syringes, and that's going to last, 9 months to a year. Some people, depending on how much we need to volumize, we've done 3 to 4 syringes before. That's rare. Typically, it's 1 syringe in each side, but again, that's not locked in stone. We may vary depending on what you're trying to achieve. And it's not. And you can do Voluma with other injectables. For instance, if you come in, you could do the Voluma here, and then do something a little bit elsewhere. So it's not something that you can't do. You have to do alone. You don't have to come in for several sessions. You can get that done with other injectables.
Perfect. And then again, can you go over post care for her?
So for post care for her, we usually send you out with a little ice pack just to keep a little ice and a little coolness on each cheek for just a couple hours afterwards. No massaging, no heavy exercise for about 24 hours. But other than that, there's really nothing to it. That's it. You can put makeup on in about just maybe half an hour or so.
Perfect.
And just go about your daily business.
Yeah. One more look for Melissa. She looks great. Look at those cheeks. Awesome. All right. Anything else?
Nope. That's it. Bye, guys. We'll see you next Friday.
Bye guys, if you have any questions about Voluma, you can give us a call or visit our website at thecenterpc.com, and our phone number is 574-968-3510. Hope you have a great Friday, and I can't believe I'm going to say this, but go Irish, and make sure you guys check out Miss Sarah Downs walking the catwalk this Saturday at Goshen Theater for their big fundraiser. Alright, bye guys.